Thank you very much, Lauriane. Good afternoon. We're now going to welcome David Sinetti, who is the Interministerial Coordinator of the Accreditation of Digital Health Service, and Hossein Konsari, who is the Medical Director of the Health Data Hub, in order to introduce the conference. I've got questions for both of you. Hossein, could you tell us why the Health Data Hub has decided to support these data challenge competitions? Thank you very much, Agathe, for all your work in organising this. Thank you to everyone who's here. Data challenges are a way of helping people get to know the world of health data, to people who are not who don't know it that well. So we want to give health data international visibility. So it's an international competition. We've already carried out one data challenge with the French Pathology Society on cervical cancer. This was something that was a real success in the way it was organized and from a scientific point of view. So after this initial trial, we felt that it would be possible to restart the process and open it up wider with a bit more financing. And the French Pathology Society is a real supporter of this. David, I've got a question for you. These data challenges are part of the health data strategy. Can you tell us who is supporting this initiative? Good afternoon, Agathe. Good afternoon, everyone. I'm delighted to be with you. Thank you once again for everything that you're doing within the HDH in order to support these data challenges. Within our department and the interministerial initiatives, we identified a number of key focuses to promote within the ecosystem. People flagged to us issues around data access, particularly for use in AI. So we felt it would be very natural to support the pre-existing data challenge initiative, and we wanted to continue it on within the digital health acceleration strategy. So it's a very key action for us around data. It's not an isolated action, it's part of a strategy which is aiming to facilitate data access, particularly with the Hospital Data Warehouse project, which is soon going to be launched. So we've got another research program on health data, and there are other actions that we are putting in place around this whole field of health data. Hossein, second question for you. In your view, what is the interests of these different groups, such as health institutions, to organize such competitions? Answer. From an HDH point of view, it's great to get people working on our data, people who are from a community that's not necessarily connected in with health data. There are some specialities that are closer to health data work, and with this call for projects, we wanted to promote some specialities that perhaps don't have such a legacy or a clear legacy of research. Perhaps they work as individuals on this area. So that's something we wanted to promote. The second advantage is that the work on these data sets can enable us to pose the foundations for longer term projects, issues around regulatory and legal issues that will be solved through this data challenge, will enable new projects to be implemented. To answer some of the specific questions for the data challenge, we might be able to create new databases and do all sorts of long-term work on health data. Thank you very much. David, what can the data challenge competitions do in order to promote health on a nationwide level, both for citizens and for health professionals? Answer. I'm going to mention what Hussein said. There's a training issues. Healthcare professionals are not trained in data science in their training. So it's part of our acceleration program. There's a big issue around training and education. So with most medical training is very much lecture based in lecture theatres. We want to get healthcare professionals to get their hands dirty with these data challenges and to look forward. They're going to see the use of data in their practice. They need to know what the limitations of this is, and they need to understand where this data comes from. It's a good way to do that. I want to congratulate all of the prize winners who are here with us. Thank you for your commitment, and we're counting on you to draw in other professionals and other institutions in order to create a snowball effect, so that when we have the further editions of the data challenge, we can have more and more people involved in these challenges. In terms of citizens, it's more of an indirect effect, but obviously all of the work that's carried out on these databases and algorithms are aiming to create innovations, and then hopefully in the future will enable us to improve the way that the healthcare system is organized.